Hello everyone, I hope you're doing well. So Life with Nurse Carol, today I'm going to bring you one of the things our African communities have decided to take on as doctors. There are so many misconceptions in the society, and as a medic, sometimes I just listen. While you think you're a medic and you went to school and you have all this information, some people are medics by experience, they are doctors by experience, they are nurses by experience. So today I want to bring you the diagnosis that our society actually gives. One, this is usually in the hospitals. Whenever a child goes to the hospital, the easiest thing for doctors to give parents when they check, for example, the CBC, instead of them coming out to explain to these patients, maybe that this disease is caused by this and this, it's very easy. They just say infection. Of course, they've given them a bunch of antibiotics. Sometimes they've just given them multivitamins. But yeah, I think as medics, we need to come up with a better diagnosis to explain to our people. The infection could either be bacterial, viral, parasitology infections. So let's be specific. Otherwise, the word infection is quite broad. This is another thing that I grew up hearing. Whenever someone has a rash on their skin, the automatic diagnosis is syphilis. Okay, I know so many of you have heard that. The next thing, whenever someone has some chronic abdominal pains, ulcers. Whenever someone has an acute abdominal pain, that person has typhoid. If you see anyone moving, they've lost some weight, their lips have become red, not with lipstick, those ones have HIV. Any person with fever and headache, that is malaria. Whenever a couple gets married and they fail to get children, the woman is barren. Most of them are actually misconceptions, and they are not true. Not everyone who has abdominal pains has ulcers or typhoid. Not everyone who feels a fever or has a headache has malaria. Please go ahead, do some tests. There are those specific tests that will rule out some things. So instead of us treating blindly, like you usually do, someone is given antimalarials because of a fever, you're developing a lot of resistance in the community, and this will affect generations and generations. And it's very expensive to develop these drugs. Giving antibiotics for flu, it's not right. Treating everything, every rash like syphilis. Syphilis is a sexually transmitted disease, and it takes some time for it to manifest in the ways that you think it manifests. So the best way to rule out all this, just go for checkups, and the diagnosis will be straightforward. Instead of you starting up medications and you don't know, you're trying to treat and it's not healing, you'll be very frustrated and you'll not get the feedback. Then this goes to my herbalists, the local pharmacists. You pass the streets and then you hear someone shouting, I don't know, shouting, okay, announcing, broadcasting, okay, ngayelanga, some herbal medicine, one type of herbal medicine, but it cures diabetes, it cures hypertension, it cures epilepsy, it cures fibroids, It cures gonorrhea. It cures COVID. It cures migraines. What kind of components, chemical components are in that medicine? And then you find people actually going to buy those medicines, sometimes very expensively, sometimes in very large quantities. Someone tanks in a whole 5 liter because they were told this drug can cure over 10 diseases, and they actually believed. You're going to affect your liver. And then this belief that everyone who has epilepsy, whenever they're having an episode, a seizure episode, people tend to abandon them because they believe that their saliva is contagious, that if you touch in the saliva of someone who has epilepsy, you will equally get epilepsy. You're very wrong. Please, let's help out these people, because while you're looking at them, that they will transmit this illness to you, which is wrong. This person could actually be aspirating some things, and they could end up with pneumonia, or they could actually die because their airway could be compromised. These people could fall into fires, and if you're just there looking at them without helping them, they could end up with very big burns, with very noticeable trauma out of their seizure episodes. So let's help one another. Let's keep updated. Let's keep informed. Always watch out for these. Educate the people in the community. As usual, Life with Nurse Carol brings you medical facts. You can go ahead and Google, but Google has a lot of things, so you might be misled by it. So thanks for watching. Don't forget to subscribe. Don't forget to watch other videos that I've shared earlier. Thank you. Have a blessed Easter. Love you.